China and Italy are at two ends of the spectrum right now. Italy's death toll continues to surge, while in China it has stabilized. This trend reveals just how important social distancing and lockdown measures are. Let's talk about China first. The entire province of Hubei in central China was locked down by late January. The epicenter of Wuhan city was completely shut off from the rest of China and the world. And so most of the infections were reported within Hubei. There were comparatively fewer deaths in other parts of China. So China was essentially able to isolate the virus. In Italy, we saw something very different. The first cases were reported in the Lodi province of Lombardy, but lockdown measures were slow to be imposed, and so the virus spread. Right now, the worst affected province in Italy is not Lodi, but Bergamo. The Lodi province, in fact, has only half as many cases as Bergamo. The takeaway here is that timing is of essence. Italy, with 60 million people, has surpassed China's death toll. But had Italy imposed social distancing measures immediately after the first case was reported, things may have been different. So what can India learn from these findings? Having a young population is most definitely an advantage because the millennials have a higher recovery rate. But social distancing is equally important, crucial. If restrictive measures are not imposed at the right time, India might lose the chance to flatten the curve of the spread of the pandemic. Now, we spoke with Shailaja Chandra, former Health Secretary at the Ministry of Health and Family Welfare of India and former Delhi Chief Secretary. She told us about what needs to be done immediately to prevent the outbreak. She also told us if India should follow Wuhan's footsteps when it comes to shutting down public transport.
Is that some people may have filtered through the screening and reached their homes, and the homes means the larger community. It is essential that one gets an idea of what is happening in the community. I know you cannot screen entire trainloads of people or entire, you might say, groups of people, because it might just give you false negatives, or it might also give some sort of a spike which will have everybody worried. But it is necessary to plan for that, because without that one will not be able to understand what is happening in the community. So by now one should know where are the red flags going up. Wherever there is a case reported, there is a wider community which needs to be randomly checked. People who've come into contact, wider people in that area where the suspected case lives, so that with the random sampling, it is possible to know what is happening. Now, it's not as though that will be the end of the story, but it starts a drill and it leads to an SOP, a standard operating practice. You must remember, India is 732 districts. It is also something like 640,000 villages. So this SOP has to reach the health officers, the chief medical officers, the district magistrates. I don't think, at least I don't get the feeling that they know that this may become necessary. If not today, maybe 5 days from now, 10 days from now. So that is one. The second thing that I feel is that there's enough awareness in Delhi. Definitely there is awareness. I think that whatever the messaging that is being done, culminated with the Prime Minister's message yesterday, has had a great effect. And I can see people who were quite flippant till now and who had no knowledge have become suddenly aware. But I must add that it seems to be to me to be restricted to Delhi NCR. I don't get that same feeling. For instance, I was Skyping with people in Ahmedabad today, and it was business as usual, and they were already planning their visits to the slum areas and what they were going to do inside the homes and calling the women. There was no thought whatsoever that there is this pandemic and they must have at least a plan B. What happens if they are told that you're not going to do any of this and social distancing actually kicks into place?